Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I'm the founder and one of the manual lymphatic drainage instructors. We usually teach paid CE certificate training here at the school, but today I'm doing a little video here to tell you more about manual lymphatic drainage and the umbrella and different types of treatments that are being created under that MLD umbrella. MLD normally stands for manual lymphatic drainage. Let's get started. So in manual lymphatic drainage, what is our goal? We want to relieve swelling. When there's excess interstitial fluid within the tissues, and this is causing pain, it's maybe stretching the tissues beyond a normal range of motion, it's interfering with daily function and so forth. This is what we are trying to achieve. We want to relieve that swelling, eliminate the excess interstitial fluid so that the client can experience pain relief and get back to their normal ADLs. Now, swelling is usually a bodywork contraindication. You're definitely not going to massage or do trigger point therapy, no matter how effective you think it might be, into a swollen tissue. That's just contraindicated. In manual lymphatic drainage, that is a body work technique that was designed to specifically work with swelling. They're different hands-on techniques than normal massage and other body work modalities. Now, I trained in manual lymphatic drainage in 1995, okay, almost 3 decades ago. And when we practiced manual lymphatic drainage back in the 90s, it was primarily for oncology patients, specifically survivors who had radiation and surgical removal of their lymph nodes as part of their oncology treatment. This surgery and radiation would usually cause an acute swelling that could be treated, and it would cause, in the majority of manual lymphatic drainage patients and clients, we would see them for lymphedema, which is a chronic swelling that can commonly occur after oncology treatment. Okay, so the majority of our treatments decades ago where we were practicing manual lymphatic drainage were for oncology and cancer patients. Okay, today, the majority of students that are coming to us for manual lymphatic drainage want to learn how to work with surgical clients, people who just had surgeries, specifically cosmetic surgeries. And I have to tell you, back in 1995, we never trained on how to work with cosmetic surgeries and manual lymphatic drainage. The industry just wasn't there yet. And what's very prevalent today in manual lymphatic drainage is it's also being used with orthopedic surgeries, such as hip replacements and knee replacements. Well, you can't use the old school manual lymphatic drainage for lymphedema and use that on somebody who just had a cosmetic surgery 2 days ago. They're very, very different types of treatment and applications that should be applied. Here at the school in 2022, we now give our students 4 written protocols to work the arms and legs. We have 2 protocols for acute treatment, and we have 2 protocols for chronic swelling. Okay, so it's really important if you're not trained yet in manual lymphatic drainage, that you seek training. If you want to work with both chronic and acute swelling clients, that you get both types of treatment. You can't use a scooping or compression pumping stroke with somebody who just came out of surgery. They're not interchangeable strokes. So think about it this way. Your time will affect which type of manual lymphatic drainage treatment you will practice. Okay, so when it's an acute scenario, and this might be somebody who's just maybe 2 days or a couple weeks out of surgery versus somebody who is chronic. Chronic could be 6 to 3 months or even longer. It's really a variable definition between acute and chronic. Just think, if it's a new onset of surgery, you definitely shouldn't be pressing into swollen tissues, because any type of compression could further tear the tissue and create secondary injury. Acute swelling, is defined as resulting from things such as a recent sports injury, a recent strain or sprain of a joint, burn victims who have, they're just recovering from their burns. They could have significant swelling, especially with third-degree burns. Post-surgical treatments, if the body has been traumatized either with cosmetic procedures, orthopedic procedures, what have you, the body's response is going to swell to heal that traumatized tissue. That's an automatic response within the body. Some of our manual lymphatic drainage techniques, the old school techniques, the gold standard, are to press and pump the tissues. And what I'm telling our students today is we do not want to press or pump tissues that have had recent surgeries and traumas, acute swelling. To me, that's contraindicated, and we need to follow through on that standard. If we press into acutely traumatized tissue, new swelling, these tissues are already swollen. The soft tissue is usually stretched beyond its normal capacity, and pushing into a stretched tissue could injure the tissue. It's called secondary injury, because if you press into a tissue that's already stretched beyond its normal range, you could possibly tear that tissue further than what it already might be torn. Okay, so I hope that makes sense. We're not going to practice any of the more aggressive manual lymphatic drainage techniques. They're all very mild compared to massage, but even in manual lymphatic drainage, we have some treatments that are and techniques that are very gentle, and we have some treatments and techniques that are a little bit more aggressive. Techniques such as scooping and pumping should not be practiced with acute swelling. I would consider those the aggressive treatments. Now, this is an image of somebody who has lymphedema, and it is looking like it's becoming infected with open wounds and sores and ulcers. Chronic swelling would include medical conditions such as this lymphedema. This doesn't occur overnight. This is somebody who has probably had swelling for several years to get to this condition that you're seeing right now on your screen. Long-term oncology swelling. So that's usually resulting in lymphedema diagnosis. Any type of post-trauma long-term swelling. I fractured my ankle and ruptured my Achilles many years ago, and I have swelling inferior to the surgical scar where they repaired my ankle. So that is an example of post-surgical long-term swelling. It could have been from the fracture itself and rupture, or it could be from the swelling. I'm not sure why the swelling is there. It's obvious that some of my lymphatic and venous venules or vein tissue has been damaged, and why the area is swollen and has excess interstitial fluid. CVI, chronic venous insufficiency, interleukin, there's many different types, and other diseases that cause chronic swelling. These are all scenarios where it might be okay to practice your scooping and your pumping techniques in lymphatic drainage. Cellulite, we're including this as a chronic swelling because when your collagen fibers shorten that are attached to the skin and you lose the elastin and collagen within the skin, what happens to that interstitial fluid and even our fats? They actually are pushed up into the skin, which creates that rimply appearance as those collagen fibers attached to the skin shorten. So that's kind of like a swollen condition, and that is another thing that can be treated. It's not thought to have a great result, manual lymphatic drainage with cellulite, but there is a new research study that was published last year where they did have efficacy in practicing MLD for cellulite, and we are considering it a chronically swollen condition. So long-term chronic swelling is where the tissue is already stretched beyond its normal range, and that's their new normal. Okay, it's something that where if you move that swollen ankle or swollen wrist or whatever swollen, you're probably not going to create new tissue tears with movement of the joint. But in acute medical scenarios where somebody just had onset of swelling 2 days ago, And if you move the joint that's causing extreme pain, you're probably stretching tissues that are already stretched beyond their normal capacity and possibly tearing them with that movement. And that's usually why they're experiencing that pain. So we want to get this out there so that everybody understands that if you are going to practice manual lymphatic drainage, it should not be the same techniques, the old school lymphatic drainage for both chronic and acute swelling, especially as we practice more and more manual lymphatic drainage for post-surgical medical situations where the clients only had a couple days of swelling. If you want to learn more about this or manual lymphatic drainage techniques themselves, we do have a lymphatic drainage program here at the school at CE Institute. It's CE as in continuing education, so ceinstitute.com. My name is Selena. I'm one of the instructors here, and we hope to see you in either one of our pre-recorded online self-paced courses, or you can attend one of our live webinars or in-person classes. And until we see you in another training, be safe.